For type 2 diabetes, most of them have insulin resistance. So they are able to produce insulin from their pancreas. However, they are not able to produce enough of it. Their body develops something called insulin resistance, and they require more insulin for their body. First of all, it would be genetics. People who are more obese or have more abdominal fat have increased risk of type 2 diabetes. Also, if people are sedentary, do not move around a lot, that increases the risk of type 2 diabetes as well. Oh, it makes a huge factor in type 2 diabetes. First of all, the obesity. In general, it increases the insulin resistance. Pretty much fat in general increases insulin resistance because of the fact the insulin, the hormone that the pancreas is producing, is not able to circulate in the bloodstream because it gets stuck in the fat instead. The lack of exercise and inactivity people go through also creates insulin resistance. The mainstay of treatment for prediabetes or before they get diagnosed is diet and exercise. If they're able to lose the weight, even 10% of their body weight, for example 10 extra pounds, they can actually prevent the progression of type 2 diabetes. So if people don't control their diabetes, they can get the complications such as heart attacks, stroke, go on dialysis with kidney failure. They can have decreased sensation in their hands, their feet with numbness and tingling, and as a result of that numbness and tingling, they can actually cause them to have sores and ulcers and ultimately amputations too. I think it is a high priority classification because it's really important that we get the diabetes under better control in the state, especially because of so many people are at high risk. So many people out there don't even realize they're diabetic. If you have access to health care, that you can get recognized a lot earlier than someone who does not have access. Those without access, you see the late complications of diabetes. This is a big challenge. It is not easy to change someone's lifestyle. They've grown up this way, so you have to make small steps at a time to try to convince people to change. What I think is, I personally think you should start with the children. They're more likely to make the changes that will affect them later on in life. So if you start there, I think that if they do programs for that to increase the rate of activity, maybe more gym classes, or encourage them to have exercise outside of school as well. Those kind of things can make a big difference in preventing them from developing diabetes in the future.